Narcissistic Personality Disorder
by Carl Keeler
and Clara Wang. The diagnostic criteria for a disorder consists of two parts. You must have an impairment in self-functioning and an impairment in interpersonal functioning. For an impairment in self-functioning, you must either have A or B. Firstly, it could be an identity impairment, excessive reference to others for self-definition and self-esteem regulation, exaggerated self-appraisal, may be inflated or deflated or vacillate between extremes, emotional regulation mirrors fluctuations in self-esteem. Or it could be in self-direction. Goal setting is based on gaining approval from others, personal standards are unreasonably high in order to see oneself as exceptional, or too low, based on a sense of entitlement, often unaware of their own motivations. An example in identity impairment would be Instagram attention seekers. These girls seek validation and base their self-worth through posting photos on the internet. Their self-esteem is volatile because it's based on the amount of favorites they get on a picture. Another example of self-direction would be a child pageant contestant. Child pageant contestants' self-worth and sense of purpose is inflated and connected to beauty and stage performance. Continue diagnostic criteria. You must also have an impairment in interpersonal functioning, either in empathy or in intimacy. An impairment in empathy would be the impaired ability to recognize or identify with the feelings and needs of others. Excessively attuned to reactions of others, but only if perceived as relevant to self, over or underestimate of own effect on others. In intimacy, it would be relationships that are largely superficial and exist to serve self-esteem regulation. Mutuality of these relationships are constrained by little genuine interest in others' experiences and a predominance of a need for personal gain. Examples. An example of empathy would be serial killers, such as Ted Bundy. Serial killers lack empathy and tend to view relationships as only a way to get something. An example of an impairment in intimacy would be the modern gay game. In a modern culture, running game is an example of objectifying human beings and building only superficial relationships in order to validate your own self-esteem. A history and background of this disorder. The earliest roots of narcissistic personality disorder are in ancient Greek mythology, through which it gets its name in the story of Narcissus. Freud brought it up first in modern-day psychology with his theory of primary narcissism. This states that narcissism is a normal part of the human psyche and you can give away love and diminish primary narcissism by doing so. It was first established as a disorder in 1967 with Kernberg's Narcissistic Personality Structure essay and works. In 1968, the first use of narcissistic personality disorder was used by Kohut, in which he extends Freud's theories on primary narcissism. In 1980, it was officially recognized in Diagnostic and Statistical Manual of Mental Disorders. Some controversy. Some people say that this is not really a disorder. In 2013, controversy was caused when it was removed as a personality disorder from DSM Edition 5. The decision to exclude this disorder has caused some controversy, particularly among psychologists working with clients suffering from MPD. The epidemiology or statistics in the U.S. would be that the prevalence on average in the United States is 6.2%, averaging between 7.7% of men, which is more than the 4.8% of women. Some subgroups, there is not a lot of stats on subgroups, but it is shown to be more prevalent in African American men and women, and there's a 35% correlation with people who have other personality disorders.
Some experts say there's been no real cause of narcissistic personality disorder, but there is evidence supporting two theories. One approach to the cause of narcissistic personality disorder is mismatches in parent-child relationships through excessive pampering or excessive criticism. When a child is raised in an environment with excessive pampering, they become very egocentric and value their looks and self-worth very highly. Children then develop a high need to be special and wanted in order to maintain their high self-esteem. On the other hand, if a child is rejected, It is often tied to when a child is abused by their parents or other people that they respect as authority. The trauma, along with neglect, makes the disorder very evident by early adulthood. Some experts say there also may be a genetic link, as well as the way the brain behaves, that causes someone to think and react to environmental stimuli. The individual may be learning manipulative behaviors from the parents or other family members when they are a young child. If a child is brought up to think that vulnerability is not acceptable, they will have an inability to tune into other people's feelings and needs. There are studies that suggest that genes for narcissism can be inherited, but narcissism will rely more heavily on the environment that the person is raised. There are some studies that also look at specifically whether narcissism is genetic, although many theories as to cause, including trauma or abuse in early childhood, overindulgent parenting, and a narcissistic parenting style. Narcissistic personality disorder treatment is centered around talk therapy, which is also called psychotherapy. There's no known cure for narcissistic personality disorder, but psychotherapy can help you learn to relate better with others so your relationships are more intimate, enjoyable, and rewarding. Understand the causes of your emotions and what drives you to compete, to distrust others, and perhaps to desire yourself and others. The goal of therapy is to help a person develop a better self-esteem and more realistic expectation of others. Medicine can be used to treat the disorder directly, but antidepressants and anti-anxiety drugs may be used to hinder the symptoms. Drugs have not proved to cure the patient of the disorder. They are helpful balancing levels of self-esteem and making the patient feel better, but if the goal is to find a final cure for the disease, psychotherapy is needed. Because personality traits can be difficult to change, therapy can take up to several years. Areas of change are directed at helping you accept responsibility and learning to recognize and accept your actual competence and potential so you can tolerate criticisms or failures, increase your ability to understand and regulate your feelings, understand and tolerate the impact of issues related to your self-esteem, and release your desire for unattainable goals and ideal conditions. Here's our works cited.